continue your presentation, please introduce yourself. I would like to request you to introduce yourself, and then after you present, I'll try to do my best to summarize and translate to Indonesia what are really important on your presentation for today. Okay, thank you so much for coming, Dr. Nitesh Malhotra.
Thank you.
Introduce yourself. I do hope that everything is good for today. And then over to you, Doctor.
So good morning, everyone.
Dr. Nitesh, go ahead, please.
Yeah, I will just ask the technical part to be, can you just give me the rights because it is disabled, the screen sharing rights.
Tolong ini dikasih kesempatan kepada Dr. Nitesh untuk bisa jadi beliau susah untuk mempresentasikan. Dikasih kesempatan untuk allow Dr. Nitesh to present his presentation. Ya, untuk admin tolong dikasih kesempatan ke Dr. Nitesh untuk present. Can you now, Dr. Nitesh? Can you present your PPT now?
I'll just try. No, it's still you need to make me the host.
Okay, wait a moment. Okay, admin, silakan dikasih kesempatan ke Dr. Nitesh. Dr. Nitesh nggak bisa ini, ya. Terima kasih. Mbak Fitri, adminnya siapa Mbak Fitri? Mbak Fitri ya? Oke. Thank you. Thank you. Go ahead, Doctor.
Yeah, good morning. I think that the slides are moving.
Yes, Doctor. Go ahead.
Okay, great. So
Very
good morning, everyone, and welcome myself, Dr. Nitesh Malhotra. I'm Associate Professor at Manav International Institute of Research and Studies and at Department of Physiotherapy. So today we'll be talking about sports massage. So it's very important that any individual who is related to sports or any player requires sports massage before, during, and after the event, any of the athletic events. I hope I'm the right pace, Mohammed Arshad.
Yes. Go ahead.
Okay.
I will let you know if there is something wrong.
Okay. The purpose of the massage is now when we give the massage to prevent the injuries, to prevent the swellings, to drain any kind of fatigue, to improve the flexibility of the tissue, to improve the performance, as well as to loosen up the muscle wherever it has been actually required because of the agility of the game, and to release the muscle tension and kind of an inflammation which we usually see post-event. So when we talk about the massage actually, some people, there's a myth that it works on the obesity, it reduces the muscle mass, it improves the muscle strength. So it is not at all. It does not affect on any of these three categories. So when we talk about different massage, you sitting in Indonesia must have heard the word Thai massage, training massage, Shashtu massage, aquatic massage, Swedish massage, trigger point massage, and now today we'll be talking about sports massage. So we'll be just briefing on the this presentation part, and we'll switch to the more of hands-on part. Okay. So it's very important to know why this sports massage and what is the therapeutic use of this sports massage. Now, this sports massage was designed to reduce the injuries there are different techniques to bring down the adhesions to soft tissue scars. Now, when we talk about the techniques in the sports massage, okay, there are different techniques. When we talk about effleurage, it's a light gliding strokes up and down over the skin without moving the deep tissues. Okay, and it is basically used for relaxation or initiating the touch sensation. for an individual. Now, when we go to the petrissage, it is a kind of a kneading manipulation, which is a little more deeper. Okay, and it is not lighter as well as quite not deeper. It is in the middle of the pressure. Okay, and it is kind of a lift, press, and roll over the muscle technique. So it has been used to improve the circulation, reduce the edema after post-event also. Okay. Now, when we talk about the third technique, it is a kind of a percussion. It is also called as temperament. Okay, and then it comes with hacking, slapping, pinching, cupping, clapping, and these are the different techniques which are being used in percussion. Now, this actually is to stimulate the circulation. It has also been used to increase the sensitivity of the nerve endings. Okay, now which sometimes it is required in the sports to give a burst of an activity. So these kind of techniques are being used percussion. Now coming down to different techniques like frictional circulation. Now this is a motion of when the individual is using his hand, okay, or the base of the hand and been applied in a circular with giving a good amount of pressure. It has been used to loosen up and break down the underlying adhesions. And again, it's been used to sometimes there are a lot of this in some major muscles like hamstrings. So it has been used to break down these adhesions and heal the underlying tissues. Now coming to another type of technique, which is a vibration. It is a vibration which has been given fine tremulous movements which have been given by hands, fingers, to just to improve the circulation, and the part is to made to vibrate. Okay. Now another technique which is very important over here is the stripping massage. Okay, when we talk about the stripping massage, it is a gliding of the tissue. Okay, with the deeper layer of the fascia. Now it is being used basically in the post event. Okay, where the individual get adhesions or there's kind of an cramps which has been formed. To release these cramps, stripping massage is being used. Okay, it has been considered an effective and a safe method that can manually deactivate the biofascial trigger points. Using it as a direct approach with the pressure of the thumb. Now, important over here is when you are using stripping massage, okay, you need to put the body weight onto the part which you're giving the massage, and the pressure is not being given by the hands, it is the pressure of the body. Okay, we'll be coming to and we'll be explaining this on the manual part. Now, it's very important why we use this techniques. Now, injury, it is kind of in part of the injury management. Athlete always use and overuse the muscle, which may cause scars, strains, and again imbalance in the soft tissues. Okay. Now it's more of when that if it has been ignored, okay, it can cause a major kind of an injury. Again, when we talk about the sport massage, it helps to release the tension of the tissue, and it actually the lactic acid overload has been released. The blood circulation is being improved. It brings a lot of blood, fresh blood. The oxygen capacity of the tissue is being improved by the movement of the blood, and it promotes the muscle repair. Okay. Then when you talk about the sports massage, this is a part of sport injury program, and it is to be known to every massage therapist, or if it is a physiotherapist. That is very important part over here. Again, it is a major part in improving and improving the muscle, as well as it is important to prevent the injuries which is being happening due to overuse. Now, when we talk about the massage, it is again, as I told in the starting, then it is a pre-event, then it can be during the event, and it can be post-event. Now, when we talk about the pre-event massage, it is usually brief. Okay, it usually lasts between 15 to 20 minutes for an athlete, because athlete does not have that much amount of time to be for the massage for a hour before the individual is going to engage in kind of a sporting event. Now, when we talk about the post-event massage, it is more of a kind of a deeper kind of a massage which has been done to relax the muscle, to reduce the inflammation, to release the pain because of the tension which has been created post-event. Okay. Now, it also helps to relieve the soreness which has been because of the accumulation of the lactic acid. The total duration, when we talk about the post-event massages, nearly about 20 minutes. Now, as I have told that the massage procedure has been carried out in the form of effleurage, which is with less pressure. Okay, it is just to warm the tissue and just to create a tactile sensation with the individual with the hands. Okay, then comes to more deeper the petrissage. When we talk about the circular or the frictional massage or muscle stripping, then the trigger point, and then finishing again with the effleurage to calm down the tissue. Okay. Now, it's very, very important when we say that when we start with the massage procedure, you should wash your hands. The attention should be totally towards the individual or your client. Okay, you need to make your own decisions. You should be in the winning form, and all the treatment should be recorded after and before the massages being started. Okay. So when we talk about the equipment, which has been very important, you can use a massage oil, you can use a lubricant, you can use a Vaseline, you can use a cream, you can use a talcum powder. And again, it's very important when we talk about different kind of materials which is being used to reduce the friction. It can be any kind of material which you feel that it is comfortable to you as well as to your client. Okay. Now, it's very important then why we are doing this. There are certain kind of benefits which have been there when we talk about the massage, is increase the circulation, to increase the stretch and stretch the tissue and the fascia, the breakdown of the scar tissues, and increase the microcirculation around amongst the tissue. Okay. Now, coming down to the benefits, physiological benefit is to reduce the pain, relaxation of the muscle, increase the heat generation, circulation, and stretching. Okay, and again, it's also when we give the massage, it is very important that when we give the particular kind of massage, it is actually increasing the reflex section of the muscle. So when we talk about the agility part of an individual who is being going for the sports, so when we give the massage, the reaction will be much quicker from the muscle. And again, it has been enriched with a lot of blood circulation.
Sorry, Dr. Nitesh, Dr. Nitesh.
Yeah.
Wait a moment. Profesor Imam, tolong
Yes,
Profesor
yes.
Imam, tolong dimatiin ininya, Pak. Tolong dimatiin mikrofonnya. Prof Imam.
Udah
Profesor
mati.
Imam, tolong dimatiin ininya. Apa? Kedengaran suaranya, Pak?
Oh, iya.
Ya. Okay, Dr. Nitesh, go ahead, please.
Yeah. So when we talk about the psychological effects, along with the physiological effect, there are psychological effects also, which we see that the individual after the massage can reduce the anxiety. Okay, and again, it has been done to relax that individual. So it is important that one of the physiological benefit as well as the psychological benefits to an individual who is been participating in the sports. Okay, so we'll come to the practical part now. Okay, let me just unshare this.
Kedengaran, Pak Basuki. Pak Rizky, kedengaran. Tolong yang Realme 85G dimatiin mikrofonnya. Dimatiin. Yang Realme 85G Dimatiin. Ya, tell me. Kata siapa ini?
Are you able to see?
Yes, clear, very
Okay.
clear.
That's very good.
Yang Realme 85G tolong dimatiin mikrofonnya ya. Terima kasih.
Yeah. So when we talk about these sports massage, okay, we always start with the Akuraj. It starts with the applying of heat.
Tolong admin yang Realme 85G di mute please.
So we'll start with the Akuraj. Okay, we'll start.
Yes, very clear.
Is it
Thank
clear
you.
now?
Very
Yeah.
good, very good.
Yeah. So when we start with the Akuraj. That is a kind of a lighter massage. Okay, with tissue. Now, after the Akuraj, once you feel that it has been warm, the skin is becoming warm, okay, you can start with the Akuraj, which is actually picking up and rolling. Are you able to see everyone?
Very clear, very clear. Continue, Professor, continue, very clear.
Okay.
Explanation also easy to understand, and then the way you do it also very clear.
So it's basically, when you talk about it as a sequential thing, okay, after the Akuraj, you start with the Patisaj. The Patisaj, when you say, okay, you can start with one side, which is medially, the semigranulus and the semigranulus of the hamstring. And then the other side, so that you are not missing any of the sides. So basically, you're getting a little deeper massage.
Okay. Professor Nitesh, can you explain when you do, for example, massage? Can you do what? Can you say what you do, please? I see that you what is called like this. You do like this. Please explain. Well, like this. What is this?
Okay, this is petrissage where we are picking up the muscle and
Okay.
rolling it over it. Yeah, this is
Go ahead.
once you do, you start picking up the muscle, okay, and then roll it over it like this. Okay, so once you do is what you're doing is you're picking up,
Okay.
and you're rolling it
Okay.
right this way. You're
Okay.
picking up and you are rolling it.
Okay.
Picking up and you are rolling it. You're picking up the muscle and you are rolling it. Okay. Is it clear now?
Okay. Clear. Clear.
Yeah. Okay. So when we say after the effleurage, after picking up, okay, we find that there are something. This is all pre-event. This is all pre-event massage. Okay. Now you can use your knuckles also if you feel that you use your knuckles. Okay, or use your fist. Okay, to give a much deeper pressure this way. Right?
Yeah. Okay.
Use your fist, and give a little more deeper pressure over the tissue. Okay, you can start medially and then in the center, one after the other. Then once you should always start distally and then go proximally. So that is much better towards the heart. So if you're improving the circulation and if you're improving the lymphatic circulation, you go distally to the proximal end. Okay. So once you're giving a little pressure, you can keep one hand in front. And then
Professor Nitesh, wait. This is really important. Teman-teman semua, Profesor Nitesh itu menyampaikan bahwa massage itu dari distal ke proximal, not from proximal to distal.
It's distal.
Okay.
Distal to proximal.
Okay, yeah.
Towards the heart. Okay, it's always distal to proximal towards the heart. Now, this is one way when you are using the fist. Okay, and giving the pressure. Another way is once you do, you can give a pressure with both the hands. Okay. Now I'm not using my arm pressure. Okay, I'm using my body pressure over here. Okay. So I'm giving through the body pressure. Okay, I am giving through the body pressure. So it is one hand over the other. Okay.
Okay.
Right?
Okay, let me explain, Professor. Let me explain this.
Yeah.
Ya, menurut Profesor Nitesh bahwa dalam untuk massage ini kita menggunakan dua tangan yang tadi ya saling tindih, tangan satu di bawah tangan, dan menggunakan berat badan kita. Jadi bukan pada kekuatan tangan saja, tapi menggunakan berat badan. Yes, go ahead.
Yeah. Okay, so it is one hand over the other. Okay, and then give a pressure. Okay. Now it is very important when you are going towards the proximal to distal. Okay, covering more. This is a larger muscle. Then you can use a broader hand, and then once you're returning back, okay, okay, with the lighter stroke. Okay, so when you're going up, it is much deeper and much heavier from the body pressure, and once you're returning, it can be a lighter stroke.
Okay, let me explain. This is really important also. Pada saat kita melakukan massage itu dari distal ke proximal tadi, pada saat ke atas itu kekuatannya penuh. Pada saat ke bawah, dari atas ke bawah itu tangan tidak dilepaskan, tapi dengan tekanan yang hampir tidak ada tekanan. Terima kasih. Go ahead.
Yeah. The next part when we talk about is stripping. Okay, so it is more on to the trigger points. When you identify the trigger points, okay, when you say that you find the trigger point, majorly will be okay, just near to the IT band, okay, just below the ASIS, okay, near the IT band. So I'll just come on the other side.
Okay.
Okay. You can give this this way, keeping your using your thumb, okay, using the body pressure. So what you're doing is you are moving the adhesions, okay, along with you are actually releasing the trigger points. Okay.
Mhm.
So you can start with the IT band. Okay, you can start from the IT band. Are you feeling? You should always talk to your client in between. So, are you able to visualize it?
Yeah. Very clear.
Yeah.
Okay.
Again, you can identify some of the trigger points in the piriformis muscle, and then you can use the leg as a lever, okay, and you can rotate it medially and laterally. If you can see,
Yeah. Very clear.
that gives an advantage for you to give a kind of massage, which is pressing under the bone, okay, by giving an rotation medially and laterally, again to identify the other trigger points. But when you touch, there will be a pain over the trigger points, and then you identify and locate it, and then you can what you can do is you can actually use the pressure of the pressure of the thumb, to locate it and rotate the hip medially and laterally, right? And then if you change the position and locate another trigger point and rotate the hip medially
Yes, very clear.
and laterally. Yeah. So when we talk about this is about the thigh, the back of the thigh. Now, when we go to if we consider it's a very larger muscle, okay. What you can do is you can use your arm, forearm, okay, and you can give a more pressure from the body. Okay. Now this becomes one of the advantage when you have a lever. Okay, you can put the pressure, okay, and then use the leg
Mm.
as a lever, and then when you are going up from distal to proximal, what you can do is you can use this lever to extend once the muscle is into relaxation mode, and then you try to extend and then you go further up to give an advantage to milk the muscle. You want to explain this, sir?
Okay, Professor, it is what is there is a question. What is the name? What is the name of this massage that you use arm?
Deep tissue.
Yeah. Okay. Deep tissue.
What
How
you're
to
doing
spell
is
it?
you are just using one technique. So you're using this liver, and from the distal to the proximal, you feel
Okay.
that this larger muscle, some restful is there with you. Okay. And you are
Okay.
not able to hold it with your hands. So you can use the pressure from the arm and then use this as a lever to extend and then going from distal to the
Yeah.
top. Right?
Okay. Okay. Another question. Professor. How many? What is called? How many movement? Let's say how many movement? Let's say how long? The procedure for each. How many times we put our arm and moving that.
It is required for one particular muscle. Okay, for an individual, you should give at least 5 to 10 minutes.
Okay.
Because if you're covering whole of the leg, at least 10 minutes should be given.
Okay.
For the pre-event.
Jadi
If
teman-teman.
it is a post-event, then we can definitely go more.
Okay. Jadi teman-teman.
Because when we talk about the athlete or any type of sports person, they don't have too much of time. So you need to finish it within 10 to 15 minutes of the particular procedure pre-event. And then post-event, it can be 20-25 minutes of that.
Oke, jadi teman-teman in general itu 5 sampai 10 menit tapi bisa ditambah sesuai dengan kebutuhan ya. Oke, go ahead Profesor. Clear?
When we talk about the calf, okay, it can be, when we start with large. Quick, to like the strokes of the apura, and then you feel that the tissue is becoming warm. Okay. You can sleepy there on the edge, and then take down. You feel on the edge. What should always the person is to be there. Now, are you able to see?
Yeah. Very clear.
If you want to give you just cross your hand for the apura. Now it's again distal to proximal. It's again distal to proximal. Right?
Okay.
Another way of doing is when you're making the patient touch, okay, you can always give what you like to say that you give a passive stretch to the muscle. Okay, give a passive stretch and start using the stripping of the calf muscle. So you can start laterally with the areas. Okay. Covering the vascular units. So with the touch, you can feel that post-event sometimes there are a lot of tears which happen, a lot of cramps which you can feel post-event. So you can use a more deeper.
Kalau kita belum pernah ke sana, udah tahu. Cobain. Iya, udah sampai ya.
Minumnya belum ada. Ntar di warung biasa.
You should always check the line.
Okay, Professor, let me there is a question about this. What is the best lubricant to use?
Sorry?
What is the best lubricant? Lubricant
Lubricant,
like
as I
oil,
mentioned,
yeah.
it can be an oil,
Oil, okay.
it can be a petroleum jelly.
Okay.
Sometimes
Coconut, is it okay for
comes-
coconut oil? Coconut oil is okay?
Oil is okay. Oil is
Okay.
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 Oil is okay.
Okay.
Because sometimes the petroleum jelly are quite sticky. Okay, so whenever you're picking up your hand from the skin surface, it becomes more sticky. So
Okay.
you won't get that flow of the movement. So oil is much better.
Yes. Oke, ada saran dari apa namanya dari peserta. Maaf suara begitu jelas, saya dimohon penjelasan translatornya. Penjelasannya saya kira mudah diikuti ya. Tapi yang penting bahwa sebelum dilakukan proses tadi itu dilakukan pemanasan ya, pijatan ringan dengan menggunakan telapak tangan atau bisa juga dengan belakang tangan. Kemudian setelah itu kaki kita pada 90 derajat, kemudian dilakukan pemijatan sesuai dengan apa yang kita lihat oleh Profesor Nitesh tadi. Ya, nanti lebih jelasnya kalau misalnya teman-teman masih ada yang kurang begitu clear, nanti ditanya jawab, tolong disampaikan ke saya, nanti saya coba translate sampaikan ke beliau. Atau bisa langsung saja tanyakan ke beliau. Oke, Profesor Nitesh, go ahead, please.
Yeah. Again, one more technique that we can do. Because calf will be most common, calf and hamstrings are most common area. Okay. What we can do is to pop up the muscle. Okay. So it is. So you start making. It's much deeper. Again, you start distal and proximal. So, calf is one of the, when you say, then you can grip that muscle very easily. This technique can be used. Okay, in kind of a deeper massage, we want to give. And then again you can get the entourage and end of all the massage, completing the whole procedure. Right?
Okay, Professor.
So again, when
clear.
we talk about massage is not limited to the rolling. We use the same technique for the back also.
Ya, sekarang di punggung ya, teman-teman. Tadi di kaki dan paha, sekarang beliau akan menjelaskan tentang di punggung. Ya, sports massage untuk punggung.
Common area what we see in sport individual is that lower back, this area, which is lower to the thorax and just above the pelvis. So this area is more affected. Okay. And the major muscle which get affected is the quadratus lumborum, jewel. Try to hold up, try to locate this muscle. Okay, you can go with the, you can always go with the entourage, this particular muscle.
Jadi apa telapak tangan dengan punggung tangan yang digunakan ya.
Okay, and then later, with the deeper massage, you can use the picking up your hair, with the particular muscle, or you can move. Okay, if you want to see this side, again, what we do is we just pick up and roll the muscle. Pick up the muscle and you roll it. You can use little more deeper massage. Right? So yeah. You can use always you can use what to use. Rather than using the bone, you use the bone. It's very important. You use the pressure of the arm. You use your body weight. You feel that there are some additions. Stripping can be used. If you're talking about when you're stripping should be go in the perpendicular direction of the fibers. This is how we make the additions. And then again.
Yeah.
And then with the
Ya, itu Pak Adam tuh, lihat tuh Pak Adam tuh ya. Pak Adam Pratama tuh. Pijatan halus
the end
ringan.
of the session.
Ya, clear Profesor, very clear.
Yeah.
I think the patient is sleeping now.
He was already in a sleeping mode. Sorry.
Okay, I have one question, Professor. I have one question. I think it is also valuable, very good for hard worker. For example, sorry to say, construction people.
Yes.
Or taxi driver or truck driver.
It's very important for the drivers because they actually keep on sitting for a longer duration of time.
Okay,
so it's
yes.
probable that they have a lot of trigger points. So when you start with the massage, it may help them a lot.
Yes.
Again,
Yes.
we are not using the agility part over here when we talk about the drivers. But again, that part when you say there is a lot of tiredness, there is a lot of pain. Okay, and then this part is very, very important for the drivers as well as construction workers because they have to do a lot of hard work, and very, very often they get they often get cramps. They often may land up to tears.
Yes. Oke, baiklah saya akan mungkin mengulangi sedikit. I want to summarize what you have said for today. Ya, jadi tadi Profesor, biar saya lihat dulu ya, yang catatan saya adalah beliau sudah menyampaikan beberapa hal tentang sport massage. Yang pertama, sport massage itu ada tiga penggunaannya adalah sebelum, before, atau during, after, setelah kegiatan event, atletik event. Ya, itu yang kedua. Yang pertama, yang kedua adalah tujuan daripada massage support massage ini adalah prevent injury, cegah injury ya, relieve swelling, mengurangi fatigue, kelelahan, meningkatkan fleksibilitas, membantu atlet untuk peak performance, kemampuan yang terbaik ya. Warm up, pemanasan untuk merelaksasi, untuk merasakan otot ya. Kemudian menurunkan muscle tension, inflamasi setelah kegiatan atau event tersebut. Oke, kemudian massage itu tidak ada efek pada obesity, kecemasan, kegemukan, obesitas, muscle mass, dan muscle strength, kekuatan otot. Kemudian ada beberapa jenis massage. I see that there are some massages that Professor Nitesh provided from Thai massage, and then Tuina, and then aquatic, Swedish, etc. And then today, hari ini, Profesor Nitesh bicara tentang sport massage. Teknik, nah ini teknik yang tadi sudah kita lihat, teknik untuk sport massage itu kita sudah lihat ada approach. Ya, kalau kita lihat tadi approach itu digunakan di the back ya, mostly Profesor Nitesh for approach itu we use in the back ya. Yes, oke. Kemudian ada lagi Petrisage. This is really quite new for me. Difficult to. So apple-rage and Petrisage. I see that it is both used in the back.
Yes.
Yes. Okay. And then ada lagi percussion tapping. Percussion tappement. Percussion. Everybody knows about percussion. Kemudian ada lagi friction circular. Ya, tadi kita sudah lihat apa yang dilakukan oleh Profesor Nitesh, dan nanti kita akan lihat juga rekamannya ya. Saya kira friction circular itu jelas disampaikan oleh beliau tadi. Kemudian let me continue. Vibration ya, ada vibration, ada juga stripping ya. Stripping, penekanan ya, penekanan. Kemudian kalau vibrasi, menggetarkan ya. Kemudian ya, injury management melalui sport massage itu ya, atlet always overuse their muscles causing ya, kalau ya, everyone who overuse muscle can cause strain, especially sport woman, strain, tear, kerusakan ya, imbalance of the submuscle tissues, and the more injury sometimes is not. Oke. Kemudian sorry, ada ya, pre-event massage. This is really important. Pre-event massage. Ya, artinya sebelum kegiatan ya, sebelum pertandingan, usually brief and invigorating. Yang cuma 15 sampai 20 menit. Tadi beliau menyampaikan bahwa 5 sampai 10 menit, kemudian bisa dilanjutkan 15 sampai 20 menit. It is given within an hours, bisa diberikan dalam 1 jam before sporting event. 1 jam sebelum event pertandingan. Tujuannya adalah to reduce inflammation, the goal of post event, to reduce inflammation, to relieve muscle pain by decreasing tension, yes, to relieve muscle softness by dispensing lactic acid, yeah, massage should last no more than 120 minutes. This is very important. Next, let me see procedure, effleurance, petricide, circular friction, muscle stripping, trigger point, finishing up with effleurance. Tadi Profesor Nitesh sudah melihat ini kan kepada kita setiap pergerakan itu. Ya. Nah, benefitnya, keuntungannya itu physical and psychological. Both, absolutely. Reduce stress also. I believe reduce stress, psychological problem. Okay, so I think this is for me. And then please wait, Professor Nitesh, in case there is a question from audiences, from participants. Kalau ada pertanyaan, silakan diketik atau disampaikan ke saya. Okay, Professor, there is a question. What is the technique on field if there is an athlete that experience cramp? Can you explain to us about this, Professor?
I didn't hear the
Cramp.
question.
For example, during
If
football.
there's an athlete who has got a cramp,
Yes, cramp.
so again he can go for a post-event massage, which is much more deeper
Okay.
to relieve the cramp.
What is the name of the treatment technique? What is the name of the technique to reduce this cramp or to omit this cramp?
I'm not able to hear you.
If someone has cramp, for example, in football game, what
Yeah.
technique? What is the name of technique that
You can give frictional circular massage.
Okay.
Yeah.
Frictional itu
Well,
frictional.
as well as you can give a deeper massage. You can use also use stripping.
Oke. Jadi bisa kita menggunakan friksi ya teman-teman ya, Pak Adam ya, Adam Pratama. Ya, nanti karena ini direkam nanti di ini lagi. Oke, ada lagi karena kita waktu tanya apakah teknik massage ini bisa dilakukan untuk kasus operasi. Apa LBP apa? Lumbal LBP apa Pak Mbak Pita? LBP apa saya nggak tahu. Oh, low back pain. Can be used this for low back pain?
Yeah, yes, of course.
Ya, bisa,
pain, any kind of pain. Again,
yeah.
what you're doing is actually relieving through increasing the circulation.
Oke. Jadi
So
semua nyeri bisa.
will be washed and then pain can be used in pain.
Ya, semua nyeri bisa termasuk low back pain. Ya, Mbak Selvi, Mbak Pita ya. Ada lagi silakan. Oke. Thank you so much. There are no more question. Ada perbedaan pre-event dan post-event. There is, ya, kita sudah lihat tadi bahwa jelas ada perbedaan tapi pada dasarnya bahwa Pak Gani ya, pada dasarnya bahwa ada masalah lemah. Pak Umar Gorontalo, berapa kali dorongan ke atas untuk teknik average itu tidak dijelaskan secara ini ya. Tapi waktunya 5 sampai tidak menggunakan berapa lama, tapi lebih menggunakan kepada berapa lamanya. Ya Pak Umar? Ya. Oke, saya kira tidak bisa kita ada masalah waktu. Mungkin nanti diinikan Pak Prof Imam, Pak Rizky, Mbak Fitri, kalau misalnya ada waktu, karena ini tidak akan sampai habis-habisnya kalau saya menjawab pertanyaan. Oke, again, Professor Nitesh, thank you so much for this. Really important for us.
Thank you so much. Thank you, Dr. Imam.
And then Professor Imam, I hope that we need to do on-site. Not only this, because there are many questions. Sometimes there are lack of voice, there is a problem of voice, and sometimes there is a blur in camera. So, okay, again, thank you so much, Professor.
Thank you.
And then thank you so much for participant, for attendees, and then offer back to you, Mbak Fitri, moderator. Bye-bye for now.
I would
Thank
like
you.
to add over here that we have our faculty, Dr. Cidera, who is with us. That is, we are starting with the fellowship program. So I just want her to introduce with the fellowship program in sports physiotherapy. Along with that, we are planning for an fellowship program in manual therapy. So
Okay.
she'll just brief out a little about the sports physiotherapy in Manav University.
Okay.
Will be starting mid of Feb. So
Absolutely.
would just like to just gain permission.
Okay. Okay, Professor Nitesh, again, thank you so
Thank you.
much. I hope that we will can meet again in the near future. Thank you so much. Bye-bye for now. You can stay still here.
Yeah.
Okay, now I will come Dr. Kistija Bansal.